Another study design that you may come across when reading a paper is called crossover design. And a crossover design is when you have one group of people and you have another group of people, and what's happening is to the first group you're giving them a drug, and then you're going to tell them after they take this drug to wait a period of time, and that's called a washout period, where you might tell them wait 1 month so that the drug flushes out of your system, and then try the other drug. So crossover, right? Crossover means you start with one drug, there's a washout period where they're told not to take any drugs because you want this drug to be flushed out of their system, and then once that washout period is done, they start the other drug. And you could have two groups doing this. So here's group 1 and here's group 2. And in group 2, you're starting with a different drug before you're starting with a red drug with group 1. With group 2, you're starting with a blue drug. They take it for, let's just say, 1 month. After that, there's a washout period where they have to wait maybe 1 month or a week or a few days, you decide. And during that time, we're hoping that the drug gets flushed out of their system. And then they take another drug, and we can see whether it helps them lose weight, for example. So crossover design is when you're giving two groups, or when you're giving each group their treatment, their respective treatment, and then they have to wait for a washout period, and then they change the treatment. The treatment is then switched. This is a common type of study design that's found in dentistry. It's called a split mouth design, and you may have come across this in some articles. And what a split mouth design is basically where you split the mouth in half. And so if I wanted to see whether electric toothbrush is effective, I may ask you to divide the mouth in half, and I may ask you that on one side, I want you to brush with the electric toothbrush. On the other side, I want you to keep using your regular manual toothbrush. And then after 6 months, I will assess to see whether the electric toothbrush works better versus the manual toothbrush. So the treatment is what I want to test out. And in this case, I want to test out whether the electric toothbrush, which you will use on this side, is better than the manual toothbrush. I could do flossing. If I wanted to see if flossing is effective, I might tell you floss on just this side of the mouth. Don't floss on this side of the mouth. After 6 months, come to me and I want to see the gingival inflammation. So anytime you want to try out a dental product, like flossing, like brushing, like fluoride, like polishing, we may do a split mouth design where one half of the mouth is given a treatment, the other half of the mouth is not given a treatment, and then we compare. After a period of time, we compare how the mouth looks. Now, there are many ways we could divide treatment groups, and I'll use this using an example. Let's say that all these drugs are drugs for weight loss. So again, I'm a researcher and I want to see whether this drug that I have made helps with weight loss. Let's say that I use this drug, or I try out this study. So I try out this study on 30 people. And this study is, again, it's about a drug that I'm using to test whether weight loss works. So with this new drug that I have created or that I have developed, I want to see whether it helps with weight loss. I get 30 people to come participate in my study. So hypothetical example, I get 30 people to come and participate in my study. 10 people will be put in this group, 10 people will be put in this group, 10 people will be put in this group for a total of 30. The 10 people that are put in this group, I will give them a placebo drug. And what that means, a placebo is basically a fake drug. I will give them this drug, and they think they're getting the weight loss drug, but in actuality, they are not. So placebo means the participants think they're getting that weight loss drug, but really they're not. The control group, the positive control group, are getting a weight loss drug, and this weight loss drug actually works. Okay, let's hypothetically say that there's a weight loss drug that has been made in the past, and studies show that this drug actually works. So they're getting this drug, and with this drug, they will lose weight. Okay, and I know that for a fact because I know that this type of drug always yields a positive result, always helps with weight loss. And here now I have my new drug, and this is the treatment. This is the experimental treatment. This is my new drug, and 10 people will be given this drug, and this is the drug that I want to see whether it works or it doesn't work. So again, I could have 3 groups. I could have a placebo group where they're given a drug, but really that drug has nothing in it. I could give to another 10 people, I could give a positive control drug. This is where this drug is being given to them, and results do show that this drug actually works. So it's a control group, which means it always gives you a positive result. So in this case, it will help the people lose weight. And then this is my drug. This is the new drug that I want to experiment, that I want to see whether it works. And that these people here would be in the experimental group or the treatment group because they are given that new drug. And these are the people that I'm most interested in to see whether my drug works, whether people lose weight when they're in this group. So when we have people, when we have subjects, when we have participants that are participating in our study, there are many ways we want to assign them to a group. And what the most important or the best way that we could put them in groups is by randomization. So if you look at the next slide, which is right over here, I have my group of people. All these people are willing to test out or willing to come to my study and test out the new drug. What I could do is I could flip a coin, and when I flip a coin, let's say I get heads, heads go over here. The next one I get heads again, they go to this group here. Next one, I get tails, tails go to this group here. So all the heads go over here, all the tails go over here. You're randomly putting them into groups. I have no control. It's the flip of a coin that decides what group they are going in. And that's the best way. Simple randomization is the best way where there's no bias, where the participants have no say as to which group they're going in, and I, the researcher, have no say as to which group they're going in. And so hypothetically speaking here, this group could be the placebo group, where they're given a drug, but that drug really doesn't work, but they think that it works. And then the treatment B, this is the group that's given my new drug, and I want to see whether this new drug helps them with weight loss, for example. Sometimes people are randomly allocated through stratified randomization. And stratified randomization means that they are divided into groups. So stratified basically means stratum or groups. So let's say we have a group of people that are willing to participate in my study, and what I do first is I divide them. And maybe here I'm dividing them by gender. All females on this side, all males on this side. And then once I have them into groups, then I will flip a coin, and I'll say that this person can go to this group, and this person, if they got tails, are in this group. This person, let's say, got heads, they're in this group. This person, let's say, got tails, they're in this group. So they're randomly put into groups. Okay, so randomization, which means they're randomly split into a group. But stratified randomization is before I randomly split them into groups, I want them to be split up. And so I could split them by gender, I could split them by age, so 30 years and younger will go here, 31 years and older will go in this group, right? So there's many ways you could randomize. There's many ways you could group them before you randomize.